Hello and welcome. Today we will talk about prevention of bedsore and bedridden patients at home. Our learning outcome. At the end of this health teaching, the learner will be able to state the meaning of terms bedsore, state the importance of home care for bedridden patients, explain the structure and function of the skin, identify the causes of bedsore for bedridden patients, explain the stages of bedsores, identify the early sign of bedsore, explain the skincare of bedridden patients, and we will explain the do's and don'ts to be followed while providing diet to the bedridden. So the problem that there is some people they are facing when they are having long sleep on the bed because of the some health issues, and they can face some injuries and sores because of any outer cause. This can cause bedsore. So what is bedsore? It is damages of the skin and tissue resulting from pressure on the skin for the long time. The importance of home care for bedridden patients. It helps to improve the health condition of the patient. So, the structure and function of the skin. The skin has 3 layers: the outer layer, the middle, and the... As we see in the picture, we have the outer layer, it is epidermis. It provides the barrier that prevents the entry of any harmful elements in body. The dermis, the second layer, and it is the middle layer that contain hair follicles and sweat glands that moisten the skin. The inner layer, it is subcutaneous layer and is made of fat and connective tissue that gives shape to the... What is the causes of bedsore for bedridden patients? We have lack of skin care, bedridden not change and becoming dirty linen, prolonged bed rest and movement, and lack of good diet. We have stages of bedsore. As we have here, we have 6 stages. Stage 1, the skin will appear like a red color and there is some painful in the side, but still there is no any lesion. In the second stage, the patient can suffer severe pain and there is thickness in the skin and there is some redness and the lesion will be started. The stage 3, there is full thickness around the skin and it will be damage of the subcutaneous tissue. The stage 4, the full thickness of the skin around the wound with the damage of the muscles and bone. First severe stage, the skin will appear thickness of the skin with the tissue death and lacking of the blood vessels that it is supply the wound. The severe second stage, it is the tissue will be necrotic and it will be destroyed. And in this stage, the patient, it is really very difficult to be recovered, and the patient need debridement to remove the necrotic tissue to reproduce new tissue. So what is the early signs of bedsore? It will be skin color and texture will be changed, scratching of the skin, swelling of the skin parts. Part become warm to touch, and then other areas skin become tender. So for good diet, the back care we must do for the bedridden, that we must keep skin clean and dirt dry. Cleaning and drying helps in prevention the development of bedsore. Second thing is range of motion exercise, that we must give range of motion exercise for the patient to reduce the risk for bedsore, and we must be cautiously given for the elderly to prevent harm for the patient. Change position 2 hourly for the patient, and this one will prevent developing bedsore. And the positions that the patient can be lateral, right and left, supine position, and semi-fowler position with the support with the pillow. We will dose, give diet as per physician records, and we must give him diet as he like or dislike. Provide warm food. After food, rinse mouth properly to prevent infection. And the patient in tube feed, you must give the food according to the doctor prescription, and you must check the tube position before starting the food. So for don't give forced food, and don't give hurriedly food to the elderly, and let him chew food adequately. Don't instill air in the tube feed. Don't feed when patient is lying down on the sleep or sleeping. Don't spill the food particles on the bed. So this is the prevention. So thank you very much, and this is the prevention of the bedsore.